Welcome, everybody. And we're glad you can join our panel talk. Today's panel talk is sponsored by that rehab company that you all know and love, Interface Rehab. Today, we have an important topic, fall prevention. Outside of the box ideas to help your clientele and residents prevent falls. We got a great group of therapists today that will be helping me. Before we start, let me give you two really important stats. About 5% of the US adults age 65 and older reside in nursing homes. But deaths due to falls by nursing home residents make up 20% of deaths in the same age group. Another important stat, about 35% of injuries due to falls occur in residents who do not ambulate. So this is not an ambulation issue, guys. Very important topic. Let's get started with our first panelist, Nitya Sanil, occupational therapist. Nitya, what are some of the common causes of falls in the nursing home?
Thank you, Geet. So, let's just dive into the basics, right? Because if we can identify the cause of falls, then we can have effective treatment strategies in place to prevent falls. I'll give you the top 3 reasons why falls are common in nursing homes. The number 1 reason is by far muscle weakness and gait problems. And this accounts for about 24% of falls in nursing homes. So huge number, right? Number 2 reason, environmental hazards. And this also accounts for about 16 to 27% of falls in nursing homes. So again, a big number. And common examples would be poor lighting, wet floors, poorly fitted wheelchairs, equipment in the hallways, things of that nature. And lastly, number 3 reason would be medications. This includes anti-anxiety drugs and sedatives. And as we know, these medications affect the central nervous system, which increases the risk of falls. And studies have shown that the risk of falls is greatly elevated within 3 days of taking these medications. So these are the top 3 reasons why falls are common in nursing homes.
Nitya, thank you for helping us create the foundation. Let's go to our next panelist, John Wagner, physical therapist. John, give us a few words about this statement. Can physical restraints prevent falls?
Thanks, Keith. Well, there's no real significant evidence to suggest that the routine use of restraints in skilled nursing facilities have reduced falls or reduced injuries associated with falls. On the contrary, there are real life situations where restraints have led to falls and led to injuries associated with falls. So we in Interface, we're not making use of restraints. We're not recommending that restraints are used to reduce the amount of falls. In fact, we're therapists. We want our residents to move. We want to promote our optimal level of functioning for our patients. So we actually work very closely with our facility staff for restraint reduction.
Awesome. Excellent. Thank you, John. Let's go to our next panelist, Smith Gandhi, physical therapist. Smith, help us a little. What are some real life activities that we can do to prevent falls in the nursing homes?
Great, thank you. There are multiple activities that we can follow to prevent falls. First and foremost, watching seniors closely, identifying fall risk residents, and walking with those who are at risk. Providing residents with walkers or wheelchairs, making sure that these wheelchairs are within reach when safe. Reviewing the medications that the resident uses, as some may increase the risk of dizziness and lead to falls. Giving our residents protective gear like hip pads to prevent a hip fracture in case they fall. The one program that does wonders is the bladder and bowel program. A good number of our residents fall because they're trying to get up to go to the bathroom. By placing them in this program, the resident will be taken to the restroom periodically, and this way we prevent falls. Let's say if the fall did happen, then what we want to make sure is we do a detailed root cause analysis as an interdisciplinary team. Then we discuss approaches and then we implement it. One more thing to prevent falls would be a customized activity program, because that keeps our residents busy and thereby we reduce the chance of falls that may be because of restlessness. It's also important that staff members keep a track of how a resident's walk changes over time. If it gets harder for the resident to walk, rehab should evaluate these residents and address this decline. And on top of that, the one very effective senior exercise program that we use in our facilities is the Happy Feet program. This program helps improve the resident's strength, balance, and walking abilities.
Keeping our residents happy. Thank you, Smit. Let's go to our last panelist, Julie Berg, occupational therapist. Julie, therapists are the problem solvers. We're the innovators. Tell us about some of the technology that's out there that can help prevent falls.
Sure, thank you, Keith. One product that I've seen implemented in some of the facilities is called a Visi Alert. This is a compact visual alert system which will give a light which is color coded, so a visual alert to staff members to check on the resident. So you can set the timer for any given amount of time, for example, 30 minutes. And when the light turns red, it's time to go and do a 30-minute check on that resident. Also, there's the VST Balance. The VST Balance is something that we're implementing in all of our facilities we service. VST Balance is an automated fall risk assessment tool that empowers a preventative approach to care. It uses artificial intelligence and machine vision. And it gives an objective information for you to identify deficits in balance, gait, and function, the three leading indicators of fall risk. And all of these assessments are done in under 2 minutes. The system is lightweight, portable, compact. You get reports that generate after each assessment, quick standardized testing. The fall risk assessment is a 10-second walk, and you will get a reliable fall risk score from this. It offers biofeedback games, which our geriatric population enjoy to engage in. It's fully HIPAA compliant. There's over 20 years of research studies published, and it offers a 60% decrease in falls with injury in these studies. You can perform group or individual treatments. You're able to actually set up any of your residents or patients who have smartphones and send them information on personalized exercise programs. So this is very, very user-friendly, and it's very great to implement into your facilities when you're looking at decreasing your fall risk.
Julie, that is some awesome information. So again, I just want to get the name right. That's the VST Balance System. And in your buildings, we're rolling them out, right?
Yes.
That's excellent. Let's go to our last topic, and I'm going to go back to John Wagner, physical therapist. John, we've talked a lot about falls, and we've talked about things we can do. Give us some effective treatment strategies that therapists are using out there to make a difference in fall prevention.
Yes, so Interface encourages our staff to use perturbation-based balance training.
Interesting. Tell me more, please, about that.
So typical balance training is eliciting voluntary responses from our residents. So we ask the residents to reach for an object or catch an object which displaces their center of gravity outside of their base of support. The resident is voluntarily choosing to make this movement. With perturbation balance training, it's all about involuntary reactions. So the therapist would be giving small nudges to the resident, either in standing or in ambulation, can be over even or uneven surfaces. And basically it's eliciting responses from the resident, such as hip strategy, ankle strategy, stepping. It's supposed to mimic what a fall would be like. So when the resident is responding involuntarily, we've seen great carryover to voluntary reactions. we've seen improvements in balance, and we've seen reduction of falls.
Thank you. That was awesome. But we're out of time, guys. Thank you, everybody, for attending. And this panel talk is now over.
Thank you.